Hi there everyone, and welcome to today's 10-minute webinar on oral hygiene. So I'm glad that you've made it back to us today. So what we're going to be talking about in various aspects of oral hygiene, on how to look after our own teeth, but also how to support somebody else with their oral hygiene as well. So it's really important to maintain oral hygiene because it ensures that our teeth and gums are well cared for. It also makes our mouth look cosmetically pleasing, which in our generation is becoming more and more important to us. It also stops us from having bad breath, and it's also good for our mental health well-being as well. So by cleaning our teeth correctly, it can help remove any debris that we have in our teeth, but it can also help eliminate and remove plaque, as well as promote good gum health also. So how do we practice good oral hygiene? So we should be brushing our teeth and flossing in between our teeth at least twice a day, so morning and night. And you can also do it in between meals also. We should be eating a balanced diet and reducing the amount of sugar intake that we have in our diet. We should also use certain good dental hygienic products. So particularly we are looking at dental products that contain fluoride, and that includes in our toothpaste as well. We should be rinsing our mouth with fluoride also, if your dentist tells you to. So this is mostly within our mouthwashes, etc. And children under 12 should not drink fluoridated water as they might need to require a fluoride supplement if they live in a non-fluoridated area. We should be visiting our dentist at least once a year, and they can monitor for any changes within our mouth. So how do we brush our teeth correctly then? So according to Colgate, the correct way to brush our teeth is at a tilt of a 45-degree angle. We should be brushing against the gum line in a sweeping motion. We should also be brushing gently inside and outside around the gum area on the chewing surface of the mouth. We should be using short motions of a back and forth stroking sensation on the teeth. We should also be gently brushing the tongue to remove any debris and bacteria on our tongue as well. We should be flossing in between our teeth, so using at least 18 inches of dental floss and moving from inside the gaps between our teeth and around the gum line to the bottom of the tooth, gently following the curves of the teeth, as you can see in the picture beside us just now. We need to make sure that we clean beneath the gum line also, and this helps avoid the snapping of the floss when we're using it. So now we know how to look after our teeth. How do we look after somebody else's teeth? So the most important thing, first of all, is to remember that the person we're looking after, we want to try and promote independence as much as possible. So we should be looking at aspects of that person's oral hygiene that they may be able to do themselves. For example, if they've maybe not got the capacity to remember that they have to brush their teeth, but they can actually brush their own teeth, then we should be promoting that by saying, you know, we need to get your teeth brushed this morning. Here's your toothbrush and your toothpaste. Can they physically do that? Maybe they can't physically squeeze the toothpaste out on the toothbrush, but that's something that you could do to support them. Hopefully they might be able to brush their own teeth, but they might not be able to do that. They might require somebody to support them with that also. So again, we should be brushing their natural teeth at least twice a day, and be aware that some people might have dentures, etc. So we should be cleaning them twice a day as well, obviously before we're putting them in place and afterwards. The most important thing in healthcare is people that may have dentures might not have the full capacity, so they might tend to take their dentures out and put them in places. Again, this is not really hygienic. However, if they're in their own housing environment, they can do whatever they wish. What we do say though is that perhaps we should have oral hygiene products that are labelled for them. So if they take their dentures out, they can put their dentures in a tub that has their name on it, so we know whose dentures they are in the tub and they don't end up in places they shouldn't be. So obviously with our dental care, denture care, we should be making sure that once we've taken them out at night time, they're getting steeped or they're getting thoroughly cleaned, but we're also looking at the mouth when we're taking the dentures out, making sure if we can, brushing the tongue to make sure we can try and remove any bacteria, having a good look around the gums as well to make sure there's not any build up of plaque and disease around the gums. So moving on to knowing what to do if something's wrong. So when we're looking at the gum area, there might be some telltale signs if there's something wrong with that person's teeth. Usually when we brush our teeth, we shouldn't experience any pain or discomfort. There shouldn't be any redness, any swelling or any bleeding. If we do see anything like that when we're supporting the person with their teeth, then there's telltale signs that they might require a checkup from their dentist. Again, in the healthcare profession, we will be working with people who perhaps don't have the capacity. They might have challenging behaviours due to an underlying diagnosis. So we do oral care as much as we can, but we have to be aware that that person, if they've got full teeth, that they will possibly bite down on your fingers if we're trying to inspect their teeth. So obviously we need to bear in mind who it is that we're supporting and support them in a way that's suitable for them and their own health needs. This is normally all documented within our care plans. So looking at different types of diseases on the mouth, so you'll see in the PowerPoint that we have a tooth decay, as we can see there. We also have gum disease, so you can see around there's redness around the top of the tooth area and where the gum line finishes and starts with the teeth, so you can see that it's red, excoriated and quite swollen. We have receding gums, so again where you can see more exposure of the tooth within the gum line itself. We have tooth loss, which is obvious when teeth start to fall out. And if we suspect that any of these changes within the mouth are happening, it's really important to make sure that we're documenting this, we are reporting it and we're doing something about it. Because not everybody that we're supporting will have the mental capacity or even the actual communication abilities to be able to express to somebody when they're in pain and discomfort, or they may have an aftertaste in their mouth, etc. So it's really important that we're advocates for our patients and the people we're supporting and doing something about it. So we want to make sure that we're reporting it, especially if there's any bleeding, discomfort, debris, build up of plaque, anything like that. Visual changes, or if the person communicates with yourself to say there's something wrong with their mouth. So in summary, it's vitally important to make sure that we maintain oral hygiene, but it's also very important that we support the person as well and support the person's care needs as much as possible to make it holistic care whilst promoting their independence as much as possible. So thank you very much for joining us today for our 10-minute webinar, and I look forward to seeing you again soon. Bye.